Welcome back. It's still Morning Rush on Metro Television with me, Nanaya Tanobwache. In the studio is Dr. Prince OSEI from Medimosis, and we are going to continue our conversation we started last week on peptic ulcer diseases. Today we will touch most importantly on the complications, but then we'll do a recap in case you couldn't watch last week. Don't worry, Doc is here. He'll take us through what it is, the causes, the risk factors, and then we eventually delve into the complications. Doc, how are you? Last week, you were on Zoom with us.
Yes. You know, Medimosis have been doing free screening, so we were
all
in the
for the
region.
30th anniversary.
We were in the Volta region, and we screened, if I'm not mistaken, I'm yet to get the data, but around 800 people.
Wow.
Yeah, from Aflao, Akachi, then Ho. Yeah, so in all around 800 people. And it's sad to know that there are a lot of people walking around with enlarged prostates and also with fibroid that they are not aware of. Yeah, because people will come, you tell them that this is the condition we found, and they are like, hey, but yes. But that is, and it means that as Medmo, you know, we advocate for prostate health and all that. It means we have a lot of work to do. So I think after this series, we will go back to talking about the prostate. Since September 2 is Prostate Cancer Awareness Month. Yeah, we will be using that.
We'll hammer on that.
Yes, because it's really disheartening. Yeah.
Doc, let's go back and start the whole conversation on peptic ulcer.
Yeah. Very
simple name, but okay.
So last week we understood that it's just a sore that happens within your GIT, the gastrointestinal tract. So it can happen either in your the stomach itself, it can happen in the duodenum. So it combined, that is what we call the peptic ulcer. So we can have a stomach ulcer, we can have a duodenal ulcer, and it's mostly caused by eroding of the abdominal lining. So there's a lining that protects the acid from working on the or eroding the abdominal lining. So if there is a problem with that covering, then it means that there will be a sore at where it has been exposed. And we learned that starvation is one of the causes because when you starve, the acid will produce and it wouldn't get any food to digest. So then it will work on the linings. Bacteria, which is H. pylori, is another cause, and also the use of non-steroidal anti-inflammatory drugs. The common ones are the brufens, the diclofenacs, and the likes. The excessive use of it can cause that because of certain mechanisms that it goes on in the body. And we also learned that for the symptoms, you know, you can have burning sensation in your abdomen. And most people come to the hospital with chest pain, thinking it has to do with the heart, because people will come to the hospital, Dr. Makumayemi, but you investigate and you find out that it's
has
not
nothing to do with the heart.
Yes, but it's rather peptic ulcer, because the esophagus, you know, the esophagus leads to the abdomen, and the abdomen is just, the stomach, not the abdomen, the stomach is just below the heart. Yes, so your left side at the nipple, just below the nipple, that is the heart. Just down below it, that is where the abdomen is. The stomach.
The stomach is. What do you see today? What's happening in the abdomen?
So abdomen is the whole thing. Stomach is the organ. So if there is any problem, if there is any sore and you feel pains in the stomach, it can radiate to the epigastric area, which is the area around your chest. So people come to the hospital with chest pains. And you can also feel bloated, like the least food you eat, you feel like you are so full. And nausea, vomiting, these are all the signs. But the most common one is that epigastric pain that people present, and it radiates to the back too. So you have the pains within your epigastric, the chest area, and you feel the same pain at your back. So that is the most classical sign of people presenting with peptic ulcer disease.
And you made mention about the fact that it could be treated.
Definitely.
It's treatable.
Yes.
Because most of us have the idea of if you get ulcer, peptic ulcer, it can be treated.
It can actually be treated, but just that it's difficult to treat.
And it takes time?
It takes time. If you don't get the right medications, if you don't get the right advice, it will be really difficult to treat. Because even with an external sore on your skin, you know, you have to be going for dressings and all that. And even with that, it takes time before it heals. How much more something which is internal,
yeah.
that you can't apply any topical ointment or something on
yes.
it. Yeah. And also coupled with the fact that you're still eating, you know, so if you eat food that aggravates it or that irritates it, it can cause the sore to freshen up. So let's say that you have some lining covering, you know, when a sore is healing, a covering comes on it
on the
and
surface,
all that.
yeah.
But if you hit your leg or where the sore is on the hard surface, it's
like when you bruise it, it comes
yes, it
back.
comes back.
It comes off.
Yes, so
yeah.
it's the same thing with the peptic ulcer. Once you are taking medication and it's going down, sometimes you think that it's gone. So you go back to the lifestyle that you were living that caused it, and it can bruise again, and it starts all over again. So we have people coming to the hospital with recurrent peptic ulcer. But you know, with Medmosis, we have this medication which is able to really treat it, and coupled with the fact that we give advice, like we take time to advise you on what to eat, what not to eat, because people have the condition, they don't even know what to eat, because anything that you take, you feel the pain. If you don't eat to, you feel the pain. Yeah, so it becomes a bit dicey. People don't know whether to eat, whether not to eat, and all that. So those advice and all that, coupled with the treatment, can really help to completely treat it. Yeah.
Okay. Now let's talk about what we are talking about today:
yes.
complications of peptic ulcer diseases.
Yes.
What are they?
So the first one is internal bleeding. Okay. Which could be a bit dangerous
severe.
And severe. Yeah. You know, when you are bleeding internally, you might not see, as a lay person, you might not see. And it will get to a point that you may be very anemic, which can lead to heart attack and all that, because severe anemia can lead to, we call something CCF, which can lead to, it's a form of heart attack that can also affect you. When you are bleeding internally, one thing that you see is your stool. When you pass through, it will become very dark. So because of the blood that is coming from your stomach, it mixing with the acid. You know, when blood mixes with acid, it forms this dark coloration. Yeah, so when it mixes with that, you see that your stool starts becoming dark. So if you have peptic ulcer and you start seeing that your stool is becoming dark, it should be a cause for worry. It means that you are bleeding internally. Or if you have peptic ulcer and anytime you check your HB is low, it means that you are losing blood without you seeing. Sometimes it's an occult blood. You might not see with your naked eye. The stool might not even be dark for you to see. But sometimes you can, when you come to the hospital, we can do something that we call stool analysis, and you'll see that these occult bloods are in, and like you can be losing it gradually to a point that it can really drain your blood. Apart from that too, it can lead to something that we call gastric outlet obstruction. So when you eat and the food gets into your stomach, it has to move on to the duodenum, to the small intestines and all that. But when you have ulcer and there is a scar there and all that, it can obstruct the outlet of the abdomen. So you eat, let's say you eat this evening, the food wouldn't be able to pass through your stomach to the small intestine. So it means that you wouldn't be getting the benefits of the food that you've eaten. So you are eating, but you are growing lean.
Wow.
Yes, because the
moment you're taking the food, it comes out.
The food, it's stuck in your abdomen.
It's stuck in your abdomen. It can't move.
It can't move. It's stuck in your stomach. The organ, the stomach organ is stuck there. It cannot move into the small intestine. That is where absorption takes place, the small intestine. So if it's stuck in your stomach, it means that you are not getting the nutrients from the food. So
you're not seeing the benefits of the food.
Yes. So people will come to the hospital with complaints that, oh, I've been eating, but I can see that I'm still growing lean. Peptic ulcer can cause that. And with that, you know, when the food stays in the stomach for a very long time, because the acid has worked on it and it should have come out. Even if this is early morning, but let me say this, you know, when you eat and you vomit, you see that there is scent in the vomitus, the color and everything has changed. It's not like what you took in. So it wouldn't be like the ordinary food, and it can stay there for a couple of days, and it can lead to infection of the stomach itself. So you can get something that we call gastritis, which is an infection of the stomach, which can also be very painful and all that, because the stomach itself now becomes inflamed. So because the food can get spoiled and the bacteria in it can cause inflammations and all that, which can also lead to gastric cancer. So we all know cancer. It can happen to any part of the body, but you having peptic ulcer, you having gastric outlet obstruction, and the food staying in your abdomen for a very long time, causing gastritis, it can lead to the gastric ulcer, cancer. Yeah, so these are some of the complications of the peptic ulcer. So this ulcer that you say, people come to the ulcer, oh, medium ulcer, like they feels like it's just
they feel it's normal thing. It's just a normal thing, like a headache. It's
an internal thing, and it can really be difficult to treat if you don't really get the right medications. And the complications thereof could also be very difficult, because if it leads to the cancer, it means that it's now going to spread to the other organs. And as I mentioned, the stomach is closer to the heart. So the closer organ that it can get to is the heart. So it can be very, very difficult. So that is why you need to come to Medimosis. If you are having any issue with the abdomen, if you're having peptic ulcer, which is recurrent, because as I said, with the treatment, if you don't get the right treatment, it can be on and off, and it can really worry you.
But it could be severe.
Yes, Medimosis has these medications that can really treat it. Unfortunately, we don't have it on the open market. So you have to come to any of our branches. If you've been having recurrent ulcer, you need to come to any of our branches. And I can assure you that with these drugs and all that, we'll be able to completely treat it for you.
Doc, take us through the locations of the centers, and then afterwards. The numbers are already on your screen, so you can just pick any of the numbers. And then take us through there.
So Accra Central, we are at AESL building. Today I'm starting from Accra Central.
Yes.
You can also come to Adenta. That is where the head office is. That place, I always say, is a clinic, it's a herbal center, it's a prostate center, it's a diagnostic center, it's a dental clinic. So it's all in all. You can come in for any need that you need. And if you want to just walk in to get these tests done, the tests that I mentioned, the H. pylori test, the fluoroscopy to check the abdomen and all that, you can walk into the Adenta branch. That is where we have the diagnostic center, and we'll check that for you. Tema, Ashaman, you can go to J. Kojo, close to the school for the deaf. We have another branch there. Kumasi, Ahinema Kokobin, you can come there and we'll have it checked for you. But remember that Prostacure T, Prostacure X for prostate health, Femacure for females, Aphromosis Mediplus for men, and also Medimosis Garlic Capsule is available in any pharmacy that you walk to. You can get these products there.
Thank you very much, Dr. Prince OSEI, this morning for all dedication.